This is me describing sites. Today we are looking at acute pancreatitis. This one is going for the students. So, by definition, this is sudden inflammation of the pancreas. So when the pancreas is inflamed, we call that as pancreatitis. It may be a single event or recurrent, or maybe progress to chronic pancreatitis or pancreatic failure. So this pancreatitis, it can be a single event or recurrent, or may progress to chronic pancreatitis or pancreatic failure. Yes. So epidemiology, globally the incidence of acute pancreatitis is 5 to 35 over 100,000. Yes. So it causes more than 123,000 deaths. Most common cause in Zambia is alcohol in our setup. So pathogenesis. So this one occurs when there is abnormal activation of digestive enzymes within the pancreas. So you know that the digestive enzyme, their main function is to break up foods from the larger molecules, to break them into smaller molecules. So when they are activated within the pancreas, they start digesting the pancreas, thereby destroying it. This occurs through inappropriate activation of inactive enzymes, precursors called zymogens. These zymogens are proenzymes inside the pancreas. So the enzyme that is proenzyme that is most notable is trypsinogen. So, and this one, it will cause the death of the pancreatic cells. So when these proenzymes are digesting the pancreas, so they are going to cause the death of the cells. Of the cells via two mechanisms: one, apoptosis; two, necrosis. Yes. So when there is mild pancreatitis, which means there is only inflammation and edema. When there is severe pancreatitis, which means the necrosis that is happening around the pancreas is damaging the nearby cells. So, as I said, mild pancreatitis, there is inflammation and edema. Severe pancreatitis, there is necrosis, and nearby organs may become injured in the process. So, common causes, we have biliary pancreatitis. Here we are talking about the gallstones. When you have gallstones or constriction of ampulla of Vater, all these can lead to pancreatitis, acute pancreatitis. Also, alcohol is one of the main reasons why we have pancreatitis. Then there's idiopathic, and also we have got metabolic disorders, whereby there are hereditary pancreatitis, hypercalcemia, elevated triglyceride, malnutrition. Also, we have got the one that is caused by the doctors and certain procedures. So we have instrumentation, we have ERCP, endoscopic ultrasound also. And then we have got the one where you're having abnormal trauma, and then penetrating ulcer. And then we have got CA pancreas. Then we have got some certain drugs whereby we have acetaminophen, amiodarone, azathioprine, enalapril, furosemide, isoniazid, metronidazole, valproic acid, etc. Then we have got some infection, viral infections such as mumps virus, Ascaris, viral hepatitis, Coxsackie virus, and also when there is structure abnormalities, radiotherapy, autoimmune, and severe hypertriglycemia. Also, they can cause acute pancreatitis. And then we have got those that we're discussing, the way severe. Then we come to the more common causes. Then we come to less common causes. We have got scorpion venom, Chinese liver flukes, ischemia from the bypass surgery, heart valve surgery, fatty necrosis, pregnancy, and hyperthyroidism. We've got cystic fibrosis, anorexia, or bulimia. So we have got a nickname, a mnemonic here, the one that we say get smashed. That's the nickname, get smashed. G is for gallstone, E ethanol, T trauma, S is steroids, M mumps, A autoimmune, S is scorpion, H hyperlipidemia, hypothermia, hyperparathyroidism, and then E RCP, D drugs. Then we have got classification by severity. We use scores. We have got Ranson score, Apache 2 score, Balthazar score, Glasgow score, and Bisapu score. Then how do they look like? What do they present? You see? Then these abdominal pain, you find that they'll have abdominal pain that is left upper quadrant, epigastric, or around the umbilicus, with radiating through the abdomen or to the chest or sometimes to the back. Then there's abdominal pain initially. This abdominal pain initially may waste with eating or drinking, but may become constant as the disease progresses. We have got hiccups, abdominal bloating, indigestion also. And then these people, they'll have signs of gray tuna signs where there's hemorrhagic discoloration of the flanks. There's current sign when there's hemorrhagic discoloration of the umbilicus. These people are going to have pleural effusion, Mayo Robinson signs. And then the complications now. These people are going to have complications such as necrosis, hemorrhage, CBD obstructions, pleural effusion, clotting of the splenic vein, superior mesenteric vein, and also portal vein, acute respiratory distress syndrome, and also multiple organ dysfunction syndrome, DIC, hypocalcemia. So these remember these are the enzymes that that destroy the pancreas. Remember, these enzymes are responsible for the digestion. So you find that most of there'll be hemorrhage. You find that most of certain nutrients that are responsible for the function, for other function in the body, are not going to be absorbed, because these enzymes are not being produced by the pancreas. So this is the reason why we have got these complications. So we have got hyperglycemia and insulin dependent diabetes mellitus. So for this one, and we have got malabsorption. This is what we said, because there's malabsorption, because the enzymes that are responsible for absorption of these nutrients are not going to be present. They'll be unable to be produced, and then because of that we are going to have insulin dependent diabetes. And then there's one point, there will be clotting of the splenic vein and superior mesenteric vein and portal vein. Yes. So differential diagnosis, we have got because remember this is upper left quadrant. Remember the organs that are there, I find that the stomach. So you suspect perforated peptic ulcer. You suspect again biliary colic, acute cholestatic, and also pneumonia, also pleuritic pain, myocardial infarction. Diagnosis. So in diagnosis, we start with a clinical history where you ask if somebody, let's say for example, if somebody they are chronic alcohol, then you will suspect that no, this one it might be acute pancreatitis. Then you go to the physical examination where you examine your patients, and also you do the tests such as pancreatic enzyme test, where you check for the recent levels of amylase and lipase, and also you do the revised antenatal classification that requires 2 out of 3 of the presentations, where you are going to have abdominal pain consistent with pancreatitis. Also, you're going to have elevated amylase or lipase level greater than 3 times the upper limit of the normal. And also, you are going to have imaging consistent with acute pancreatitis. Then that's when you do your CT scan, your MRI, and also the ultrasound. And then treatment, you do the fluid replacement. Where you are going to give them 5 to 10 ml of isotonic fluids, but the one that is preferred is Slinger's lactate over normal saline. That's when you're going to remember these people are in pain, so you are going to give them. You're going to control the pain. You're going to give them morphine, opioids, and also remember these people are what? These people are malnourished. You see, they are malnourished. So you are going to do the nutritional support via enteral feeding, and also remember these nutrients, they are malnourished, which means they have got a weak immune system. Weak immune system, thereby they are prone to infections. So give them antibiotics. To eliminate certain infections. You do ERCP if this one is recommended if the gallstone is detected, and also you do the surgery of cholecystectomy. Also you do this when you do the surgery if there is pancreatic abscess, necrosis, so on and so forth. Then the prognosis. Severe acute pancreatitis has a mortality around 2 to 9%. It's higher where necrosis of the pancreas has occurred. So we have got one of the modified Glasgow criteria suggests that a case may be considered severe if at least 3 of the following are present. 1, we've got partial pressure of oxygen if it's less than 60 millimeters or 7.9 kilopascals, or if the age is greater than 55 years, or if there is neutrophilia that is greater than 15,000 cells per liter, or calcium that is less than 2 millimoles, or renal function, blood urea nitrogen if is greater than 16 millimoles per liter, or enzymes LDH, especially if is 600 international units per liter, and also albumin if is less than 3.2 grams per liter, or sugar glucose if it's greater than 10 millimoles. So we have come to the end of short presentation of the acute pancreatitis. So subscribe, hit the like button, subscribe to the channel. This is Mediscribes Insights. Subscribe for more.